What up? It is a 10 show with a side of whiskey. And today I don't have my whiskey. I just came from a run. So I'm drinking. Stay hydrated, everyone. Happy weekend. I know you guys are happy because of the 4th of July weekend. What you guys are doing? What are you guys doing? You guys have any plans?
I'm emphasizing the fact that you said you went on a run.
I did went for a run, all right? My type of run, my slow-paced snail type run, all right?
A taco truck was getting away.
No, it was not the taco truck. It was the whiskey truck, all right?
I guess you didn't catch up to it since you don't have.
I didn't know. Yeah, I got tired quick. I ran for like 10 seconds.
What do you got
running is running.
Yeah.
What do you got planned this weekend? It's a special day.
I'm going to San Diego, so I don't know about you guys.
I'm going to Mexico.
Yeah. So, for everybody that's listening that's not military, 4th of July is a very special day for us as patriots, war fighters. We definitely take that day as a special day to celebrate our independence and the continuing fight to maintain that independence from all other countries. So
absolutely,
it's a big day to celebrate. It's not like Veterans Day where we're praising everybody that's gone to war and those that haven't but have served. It's not Memorial Day where we're giving our thanks to those that gave their life. It's a day to celebrate and really emphasize our freedom. So
absolutely,
yeah, party time. Party time, barbecue, drink.
Yeah.
And have
so
fun
if you're watching
family.
this right now, just go ahead and comment, what are you guys doing over the weekend? So share your journey this weekend. And so today we have an awesome guest, and actually I'm gonna pass it over to Jose. So we have an awesome guest that is gonna help us to explain a little bit about the mental health as a professional. So Jose, I'm gonna pass it over to you, man. It's all yours.
Yeah, can you guys hear me?
Yeah, I can hear you.
We can hear you and the dish is being washed.
Yeah.
You can hear the dishes. Well, the dishwasher. I'll turn off the
need more lighting.
You
need more lighting.
You're
dark.
You're good.
Dark.
I'm just dark. I was born like this. My complexion, you can complain to my parents. But yes, so I actually have the honor and pleasure to work with Dr. Greenberg on a daily basis and on a lot of the projects that I've talked about and other episodes. Not to the extent that would get me in trouble with the VA, but definitely I'm going to pass it on to Dr. Greenberg to give us a little bit of background about how you got into mental health and what you do now, and your background, sir.
Thank you, Jose. Yeah, thank you so much for having me on the show. This is great. We really, really appreciate it. Thank you all for all your service, first of all. Most importantly, we really appreciate it. Happy 4th of July, everyone out there coming up here. So yeah, I'm Jared Greenberg. I'm a psychiatrist here in Los Angeles. And so I work at the VA. So obviously I work with veterans. I want to say at the outset that any of my views that I express do not represent the VA or views of the VA. I'm just purely representing my own personal views. But yeah, I got my start in mental health a little bit later in my life. I came to this as a second or third career. I decided I wanted to go to med school when I was in my late 20s. I was doing some relief work down actually in Honduras, and just, the whole thing of helping people in this way really caught fire. In that case, it was in a medical setting. But anyway, so I went on to decide, okay, I think I want to become a doctor. Went through that whole process of going back to school for my pre-med and then doing medical school. And somewhere along the line decided that I really like to roll up my sleeves and really get to know the inside of a person, get to know what makes a person tick, right? Get to know about their relationships, get to know about their life story, get to know about, what moves them, get to know their inner world, basically. It's a very, very intimate thing. It's a great, great privilege to be able to get to know someone on that level. And I just really love to be able to help people in this way and to actually help people who the rest of society often shuns, right? So that ended up becoming, what's now my life's work of being a psychiatrist. I went to med school at USC right here in LA, in Boyle Heights. went to residency.
Right on.
Yeah, exactly. Fight on. Went to a residency at UCLA, so I kind of switched teams there.
Oh man.
Did my psychiatry residency there, and that's actually when I first started working at the VA through the residency program there, and decided to stay on and work with veterans because I find that work really rewarding, and that's what I do now. So I do a lot of my own clinical practice where I see veterans treating all kinds of diagnoses of mental conditions. So I do that on a direct one-to-one patient care. I also am involved in supervising and training residents who are coming up and medical students who are learning how to do this work. And I'm also involved in some research that I have the great pleasure of working with Jose on, looking at how to improve services for veterans, particularly veterans who are homeless or have experienced homelessness, and also, of course, veterans with any type of mental health conditions or behavioral health conditions. So that can include substance use and things of that nature.
During the pandemic, that all like the face-to-face had to shift a little bit, right? So it's how was that transition when that impacted last year?
Yeah, it was very rough at first. It's mostly from just a logistics standpoint, right? Trying to get the word out and, hey, people, don't come down here. It's not safe. We're going to call you. We're going to set this up. But we hadn't used the technology before, most of us, or had just barely started to. So it was a big logistical shift. But I will say it actually, from the standpoint of actually delivering the services, it actually went pretty smoothly because it's just kind of like what we're doing, right now. In mental health, we have the privilege that we're able to do this. And I think it's actually, maybe not 100% as good as being in the room with the person, but it's much better than, let's say, if I had to, if I was a surgeon, I can't do this over a Zoom, or if I was, a primary care doctor where I have to examine you, so it actually went pretty smoothly. So from personal experience, I don't know if you saw a surge in more attendees over online, because I could say that I was reluctant to go and make the drive out to a psychiatrist. I was reluctant to go to seek counseling in that way, just because it was time out of my day. I actually had to get into my vehicle, drive the 32 plus miles into the VA, because that's when I used to live in the Inland Empire. But now that when the shift happened and Corona happened, I was like, hey, you know what? I could just sit in my living room, in my room, and talk to somebody. So I don't know if you saw that shift where there was more attendees. Yeah, that's been seen in a variety of settings. I happen to know that at UCLA, they've seen a really large increase in their show rates, a decrease in the no-shows. And so that's definitely been the case. Similarly, at VA, we've seen that too. And it turns out to be a lot more convenient for some people. And, you bring up a good point. I mean, for some people who are even concerned about not wanting to go into a mental health clinic where they might be perceived as having some kind of stigma associated with mental health, now they can do it for the comfort of home where it's very private. So there's pros and cons, but there's definitely been some pros, and it's a reason why it's going to stick around. Even after the pandemic is over,
that's good.
This is going to stick around. It's going to continue to be an option for people who want it, for people who prefer it.
Yeah. I just recently had my session, and I was asked, do you want to do telework for your next appointment, or you can come in, you can pick. So that was a nice choice to have, especially when, for me, my sessions are pretty short. I try to keep them short and sweet. We go through what's been going on and move on. So it has made it a little bit easier with not having to go in for a 30-minute session or 45-minute session. But, in 2019, the AFMAN, the Family Readiness Center, did a survey on telecommunication or telemed or med TV. It's called so many things. And one big thing was that 71% of veterans or service members that were exiting the military said they wouldn't do telecommunication or anything like that. But I like you said, that shift has definitely changed. Do you see like that veterans appreciate it more versus, before it wasn't even offered, before COVID, it really, and now it's kind of been forced on veterans. Hey, you either want it, You need
Or
to
you don't
take
get
what
it.
Yeah, you got to take whatever you can. Phone call or have you seen like a bigger spike of veterans now saying, you know what, I'd rather stay like I have. Have you seen that or?
Yes, yes. I've seen that a large number of people would actually prefer to stay with doing remote now that they have had that option, now that they've tried it. I remember I used to have veterans at times who would ask for that before it was an option. And they would say, man, I don't want to come all the way down. Can we just talk on the phone?
Yeah.
No, actually, I know I can't do that. So now I can. Now there are those few people who really, really prefer in person. They say, doc, this doesn't work for me, and for a variety of different reasons. And keep in mind too, there in a certain sense, you have the privacy of home, but look, not everyone has privacy of home, meaning that someone who they need to not be in the same room as
wife, kids.
Exactly. And their wife, and so on, their partner, their husband, whoever it might be. So some people do very much prefer the privacy of the office, and I can understand that too.
Yeah. Makes sense.
Yeah. So actually, one of the biggest reasons why we wanted to bring you on the show, sir, was to talk about a little bit of those stigmas that we, prior to the show that was starting, we were discussing a little bit.
Mm-hmm.
So I know that when I had recently gotten out, I know it's the same for Pedro and Will. The stigma about medication, or actually the stigma of psychiatry in general.
Mm-hmm.
And I know that when I had recently gotten out, I was like, no, man, they're just going to pump me full of drugs, and I'm going to be zombied out the entire time. Which did happen the first couple months. But I didn't know that there had to be a transition or a adjustment period within that. But I don't know what your thought about that medication and the stigma by psychiatry.
Right. Well, it's certainly getting better. However, psychiatry as a field and mental health is still definitely very stigmatized in a lot, by a lot of people and to a great degree. And, so obviously that works against what we're trying to do, which is we're just trying to help people have a better life, And so, but there's a lot of historical reasons why, unfortunately, not only psychiatry, but all of medicine has had some, pretty harmful practices. So speaking specifically of psychiatry, yes, people who have been over-medicated, people who have been, held against their will, a lot of different things that have happened over the many decades of psychiatry. So those things are getting better, and we want to keep spreading the word that, coming in for help, first of all, it doesn't mean that you're broken. It probably means that you've been through some very difficult things, and we want to help you to deal with those very difficult things that you've been through, right? There's no shame in coming in for help. Everyone needs help in some fashion, in some form, at different times in their life. And so, we hope people will embrace the idea that, psychiatrists, just like any other healer, we're here to heal the psyche. And that's actually what the word means. Psychiatros. Iatros is a healer. Psych is your psyche. So that's what we want to do. And we want to be able to spread the word with that message.
I want to add something. Like in media itself, like in movies, right? They have this negative connotation towards, psychiatry too. So it makes it very difficult for the consumer to say, I'm going to go get help from a psychiatrist because what they see in the media. So it really changes the perception of getting help with psychiatry, is, and I do want to add, like, one of the things for me when I got out of the military, I just didn't want to get help in that sense. And a lot of it had to do with me upbringing. I can tell you, my dad was like, I don't need help. He had major PTSD, but he was one of those, right, like old school mindset. And then so I grew up with that too. But, like you mentioned, like it's culture too. So I realized that, getting help is important, help going through past traumas before and after the military, so it really helps because you tend to, if you keep things to yourself, and then it's going to be hard to relate with others, and you just feel like you're in a corner and no one is there for you. So, but if you guys are watching right now, it's okay to ask for help. Yeah.
Do you as a psychiatrist take that into consideration, the culture of that individual that's coming to seek for help?
Yeah. Yes, we do. I mean, we certainly try to. Do we always do as good of a job as we possibly could? I doubt that we do, but that's definitely an area that's probably one of the most important areas of, let's say, growth or development, or just a lot of discussion within the field right now, just because of everything that's been going on in the world, in our society, of trying to really take into account where someone's coming from, what community they're coming from, what are the structural factors in their lives and in the community's life and our life as a society that affect people's mental health, because people's mental health comes from a lot of different places. People's mental health comes from, not only, speaking of veterans, traumatic experiences that they've had in the military, but people's traumatic experiences they've had in their life, and including traumatic experiences of things like racism. So it is very important to keep those things in mind.
Absolutely.
So as moving towards, I guess, methods of therapy and approaches to, a lot of these psychotraumas that veterans go through, whether it be, anxiety, PTSD, what is it that, I guess, your opinion on your approaches, or what you would use on some of your patients, and do you move directly towards medications, or is that something that you save for later? I don't know, an opinion.
Right. Great question. Well, to answer that best, I would need to kind of expand the question beyond just myself as a psychiatrist into more of like the mental health team, because the fact of the matter is that although I personally value a lot of different kinds of modalities besides medication, within most like structured healthcare systems, whether that be the VA, whether that be Kaiser, whether that be the county healthcare system, we as psychiatrists are generally tasked with the medication aspect of treating our patients, because although we can do therapy, there's a lot of other disciplines that can also do that, like social workers, like psychologists, like MFTs, etc., whereas they cannot do medication, and we're the only ones within mental health who can. So the point is that it's almost like a division of labor issue, where because there's so much need that we end up getting put in that role. So that's just a preamble to say that just because of the fact that I'm personally am going towards prescribing for someone, that's my role within the clinic. But if I'm looking as a whole team, where our psychologists are involved and the social workers are involved and those kind of things, medication is definitely not the first line necessarily for a person with a particular disorder. And we're talking about PTSD, for example. Medication is certainly not the only answer. Medication, we really want to use medication to treat specific symptoms that those medications are helpful for. Yeah. We don't want to treat the person with a medication like this medication is going to alter the person. We don't want to treat even the condition with the medication that, this medication is going to cure your PTSD. The medication is meant to treat specific symptoms. So if a person is having nightmares, there's medication that can help for those nightmares. If a person's having really bad anxiety, there's medication that can help with that anxiety. If a person's not able to sleep, there's medications that can help with that. Although there's a lot of other better ways to get good sleep than medication.
So psych triage.
Yeah. So we use medication to treat those things, but we still want to treat the whole person. We want to treat all the issues. And very, very often that includes different types of talk therapy and those. And I really think what works best is even in, whenever it's possible, if a person needs medication, is to be able to combine those two things, both medication and therapy. Those are some of the best outcomes, is when a person's able to do both.
I want to. Oh, sorry.
Go ahead, Will. Go ahead.
Yeah, I want to scale it back a little bit, to more of an informative scenario. You have psychiatry, you have psychology. You just talked about a little bit about your team.
Yeah.
Could you explain to veterans the difference in what services are provided by a psychology team and a psychiatry team, specifically for veterans?
Sure. And it's very similar for veterans as it would be for anyone else. And the different healthcare systems are very similar in this way. Of course, there's differences. But a psychiatrist such as myself is a medical doctor. So we're medical doctors that go to medical school, and we can prescribe medication. We learn about the human body and medications, everything that has to do with that. But then once we get out of medical school, then we subspecialize in psychiatry, where we're really focusing on mental health within the medical field. But now you insert us into a team that also includes psychologists. Sorry, let me back up. Psychiatrists also receive training in talk therapy. So we are trained in talk therapy. I don't want to say that we're not. We are trained in it, but oftentimes the organizations don't pay us to do it once we get out in the world. Yeah. But anyway, we could do both. Yeah. Now you have psychologists who are not medical doctors. They don't prescribe medication, at least not in the state of California. In one or two states they do. But they either might have a PhD, most likely, or something called a PsyD, which is like a clinical degree, a doctorate. And so they really specialize in doing the talk therapies, all the different kinds. So that's the main difference between psychologists and psychiatrists. There's some overlap there, but they have different paths of training, and psychiatrists can prescribe medication, whereas psychologists don't. Both can do therapy, but the psychologists more emphasize and more focus on the therapy part.
Yeah.
So for people that
work together, we try to work when it's working the best. We're working together in consultation with each other.
Okay. Yeah. Okay.
But and that's the big thing, and big difference. If you are looking for the talk therapy, the sessions where you're gonna go talk and discuss on methods, I've seen more of that side with psychologists.
Correct.
Whereas with psychiatry, it's more, I will say what I'm experiencing, what issues I'm having, and then either adjust my diet, adjust my exercise, adjust my medication, make sure that I'm not conflicting my pain meds with my psych meds, and make sure I'm not abusing meds either. So that's what I've captured from my experience with psychologists in the VA, or just as for veterans, and then with psychiatrists in the VA or any veteran, mental health agency that helps out. But that's why I asked the question, because a lot of times, a lot of veterans confuse it. They think, well, you're a psychologist, why are you not prescribing anything? No, that's not what they do,
Right.
But so that, it's good that you explained exactly what that is. Pedro, you had something, and I know it's there.
I forgot. Thanks for interrupting me 3 times, bro. It's okay.
My fault.
I do have something. So in your field of study, I know that you've done some research, and the research that you've completed and that you've written about. Can you tell us a little bit about the progress that you've made in the field of psychiatry with the studies that you've conducted?
Sure. Yeah, I've been involved in a number of different studies and research projects and things of that nature. Again, a lot of it has had to do with helping veterans who are homeless or have been homeless or who are experiencing some kind of mental health condition or both. A lot of it is focused on the idea of resilience and what can give a person resilience, what helps a person to get through these very difficult experiences. And we're not talking about medication in that case. Some of the other work I've done has to do with the whole idea of emotional well-being and what is that, and how do people define it, and what does it mean to different people, different groups of people, and also what really are some of the things that determine emotional well-being. One thing I want to say about this I think is relevant to this conversation, is that over and over and over again, when we studied about emotional well-being and looked at all the research that's been done and asked people, just regular people, about it, the things that kept coming up were, first of all, having a sense of meaning and purpose in their life. That ended up being super, super important to people's sense of emotional well-being, having a sense of meaning and purpose. And so I always try to incorporate that in all the work that I do, because if we're over here focusing on these little symptoms and things like I was talking about before, that's all well and good. But if a person doesn't have something to focus on, some kind of meaning, it doesn't mean that they have to go to a job, right? Of course,
Right.
What could give them purpose or meaning could be something related to their family. It could be a lot of different things. The other one is social connectedness. Some type of social connectedness turned out to be really, really important for emotional well-being, for most people. And so that's another thing that I always try to emphasize is how to connect with other people that are important to you in your life, or to expand those circles, because a lot of the veterans that I treat are very isolated. People with suffering from PTSD, for a lot of different reasons, they've broken off a lot of their social connections, and they're very, very isolated. So trying to expand that and to welcome them within the larger veteran community, for example, right? Having group treatments where veterans can go talk to each other. It's not just about talking to the psychiatrist or even the psychologist. Let's get people talking to each other. What helps people? They can compare, like what helps me might help you. So we really try to foster those things as well.
It's actually very interesting. So I remember when I had started working with you, and you gave me one of your research to read, because it was going to be something that you and I were going to be, with the team, we're going to be working on. And I found that there was a connection with the organization that we created and what your study is doing, in terms of giving veterans a sense of purpose, or studying at least how to give those veterans a sense of purpose. And when 10 HUD started, that was our biggest, although it still is one of our biggest missions, is to rebuild, restructure, and reinforce that sense of purpose for those veterans. Because for the longest time, when we were in the military, day in, day out, you had a purpose. You woke up with the sense of mission, and you went to bed with the sense of accomplishment that, hey, today I just ran 8, 10, 12 freaking miles, or you did something that the normal person doesn't do on a daily basis. And then you separate from the military, and you no longer have that structure and that sense of purpose and mission driven attitude on a daily basis, and we feel lost. A lot of us feel lost. And that is one of the things that 10 HUD was started off trying to figure out. We have yet to figure it out, how to install, how to plant the seed of that mission into the veteran when they separate from the military. But I think this would be a very good connection. And
yeah. So I wanted to, just so my understanding is, we have some people that are joining us right now. So as far as homeless veterans, can you say that the common denominator or the pattern that you've seen has been because they lose that sense of purpose? It could be one of the things, right? And then, like you mentioned, the community, the connection with others.
Right. I mean, right. Those are two very important things. And there's so many obviously so many different reasons why a person, might become homeless over the course of their life, and especially in LA, obviously economic hardship and just the cost of living being astronomical is a huge part of it. So we can never overlook, that part of it. And we also can't overlook just the effects of a lot of different kinds of discrimination, and including racist discrimination, but other forms of discrimination that are not favorable to, enabling a person to succeed in a variety of ways, including staying housed. But certainly when people are demoralized, right, when they are demoralized, when their sense of purpose and their sense of meaning is torn down, that is a big factor. And that is something that we want to help people to rebuild, just as you all are doing.
Right.
And also when people's social connections are torn apart, it's much harder to integrate back into the community. And we all come from a family of some origin, like some family of origin, right? And going into the military takes you out of that original family, but then it puts you into a different family, which is the military. Now, just as you were saying, we'll say now once you separate, well, okay, now what's my family, right?
No, not what.
It's,
Yeah.
it's hard to integrate back into the original family that you originally came from, because you're not the same person you are when you went in. I'm not saying this experience. I'm not a veteran, but I hear it all the time. And so, right, how to then rebuild or form new connections. Of course, the community of veterans itself is a form of connection, but it's not the same, because it's not the same shared mission that you had when you were in active duty. So yes, the social connections and getting people to regain their housing is super, and stay housed once they get there. And not only, it's not just a question of getting the housing, getting the roof over their head and then staying, it's then how do you integrate back into the community in a meaningful way that gives a person a quality of life. So
Has there been couples? Have there been studies about how to build resilience, like different modalities?
Yeah, yes, there have. It's still an early. It's kind of still an early field in that sense. And there's even been some studies within the active duty military itself of different kinds of resilience training that have been tried and actually were actually not very successful necessarily. But
it's like only 15 years old or something like that, somewhere around there.
Yeah,
right?
yeah, exactly. Something
Fresh.
like that. So yeah, it's ongoing. It exists, but I don't think we have. Obviously there's a lot of dimensions to it, and some of the dimensions are things that we're talking about already. Is the sense of purpose and the social connectedness, but there's other dimensions as well. There's a psychological dimension of just a sense of hope and optimism, because if you don't have that, what's even going to give you the drive to just keep going, right? So there's a lot of psychological dimensions to it, but then there's also, again, looking at a higher level, there's also structural dimensions about what opportunities does the person have to even pursue those things. And so at the same time that we're acting at the individual level to help the person, we need to be thinking about how as a society do we create these opportunities and, create the opportunities at the same time that we're undoing the harm that discrimination causes, right?
Right, absolutely.
Do you feel like there is a big a number difference based on ethnicity or race? Like as far as
the difference of what?
Like if there's comparison, like white versus minorities or any other
In seeking mental health, or
no, as far as homelessness.
oh yeah.
So I believe there is, and I believe that there is, I think there's a higher predominance of homelessness among minorities, but I can't quote those statistics. But again, there's such a long history of racism in this country, right? And the various kinds of disenfranchisement that it's unfortunately resulted in that.
Yeah.
If for our audience, if you're interested in the exact statistics, there is a homeless count 2019. You can look at. That was the latest homeless count, and that would give you the statistics of race and ethnicities and gender. So definitely look at that.
They
didn't do it last year.
Coming out. It should be coming out, I believe.
I don't know if they did it last year because of COVID.
I believe they still did.
I want to say they did. I want to say they.
Oh, really? Okay, so it should be coming out.
It doesn't come out till the end of June, I thought. So it should be coming out soon. Hopefully August. I don't know. Everything's so delayed right now, and especially research.
Yeah,
that's true.
What happened last year, but we'll see.
Yeah, definitely.
If you guys are watching this for the audience, if you guys have any questions, go ahead and just comment on either page you're looking at right now or on YouTube,
Facebook, or
yeah.
Just remember, audience said Dr. Greenberg can't do a full session online right now, so
yeah, they can't.
Don't start asking like, "Hey, my wife told me this, and I don't know if she was right." No.
We need to contact the VA and set up an appointment. Exactly. How about that? We could do that, right?
We should have actually. We do have the 1-800 number for the VA, the suicide hotline. We'll post them up down below. Very, very important numbers.
I have one more question. So as far as resilience, because I think this is something that I'm really well connected to this, and
Mhm.
I have I've tried different modalities as far as building resilience.
Mhm.
And so, what's something that veterans that are either are watching it now or going to watch this video later, where they can start looking for how to build this resilience, especially for service members getting out of the military? Is there
Yeah.
any is there any like places they can see, any papers they can read, things of that nature?
Right. Yeah. Yeah. Great questions. So there's, I think there's a lot of different approaches. One thing that's coming to mind is mindfulness. Mindfulness has become, in some ways, almost too much of a buzzword, right? But
It is.
um, but it can actually be a very effective way to build resilience through getting back in touch with the present, the present moment. Because if you're living in the past, right, that's a recipe, potentially a recipe for depression. If you have a difficult past. If you're living too much in the future, that's potentially a recipe for anxiety and worry, right? Yeah. So those are the way that we kind of relate those different points in time of past, present, and future. Now, I'm not saying that there's positive things about either one, but if we're talking about trying to build resilience in the face of adverse, events and circumstances. Staying in the present, I think, is really, really important. So mindfulness practice, meditation, yoga, all those things are very, very helpful. Again, establishing and reconnecting with important people in your life, I think, is a super, super important part of resilience. Using even things like using experiences from the military. And this is something I learned not from research or not from papers, but from my own veterans who I treat. And I've had veterans say, "Hey, I'm getting through COVID just fine. You know why? Because I was on a ship for 12 months and I didn't see anybody." So
Especially
there's no issue.
I know how to do this. Yeah.
Yeah.
I've had veterans who said, "You know what? I didn't feel like people could relate to me before. Some of these things I go through, some of these anxieties, some of the PTSD, I just felt like people looked at me and they're like, what's wrong with you? I don't get it." Now everyone out here is anxious. We're all anxious about COVID. We're all on edge. So at least I feel like people understand me. So these are things I've picked up just from actual veterans. Yeah.
I have to add though, because when I was in Korea, we had like a lockdown, and we were locked down for a while.
For 2 weeks, 2 weeks a month.
More than a month. It was like, I think for us, it was 2 months at that time.
Oh, wow.
And we were like, whatever. Like,
Lockdown, no problem.
No problem. Yeah.
I do have one.
I can honestly say this is kind of related to the topic of resilience, and was talking about in particular the pandemic. I can honestly say that many of the veterans who I treat have done much better during the pandemic than a lot of my friends and family. It's honestly true, and it's because of some of the resilience building that happened, whether they even realized it or not, during their military experience. In some cases, it was also because they felt more comfortable not going out as much, right? Because,
socially isolating.
That was already so comfortable. That was, many people said, "Hey, I don't leave my room anyway, so this isn't very different for me." So that became a double-edged sword, because we want to help people to, like we're saying, reconnect and re-engage. But at the same time, that was comforting has been comforting for a lot of people.
But it is a lesson in resilience for those veterans that think that, I don't know if I have enough resilience for civilian life.
Right.
And the pandemic has just shown our fellow veterans that we do. We just have a different type of resilience. We have different types of adjustments. So
It's just like you mentioned earlier. Like I don't think I would ever build a resilience of sitting in traffic and dealing with people craziness. Like for me, I'm like that my anxiety.
I don't think anybody.
So that's one of the reasons that you got to deal with that travel. I mean, that's just freaking.
I mean, as crappy this is. I mean, the spike in shootings on the highway has just gone up the roof. I don't know what's going on. I think just people losing their mind. They forgot what traffic was, and they can't handle it.
Yeah.
I got one more question, and something you just brought up with resilience. You brought up meditation, right, and other types of spiritual other what is called spiritual psychology. And how does that incorporate into psychiatry?
Well, okay, great question. I mean, it doesn't incorporate into the medication aspect of psychiatry. I shouldn't say it doesn't incorporate. It's two different things. They complement each other. So I would just consider those to be complementary. And in my view, there's no one size fits all in mental health. And the more different approaches that one has available to oneself as a provider who can offer those different things, but also as a person on the receiving end of mental health care, or just a person who is on their own quest for good mental health. If a spiritual dimension is what's going to bring that person, wellness, then that's where we want to put energy into. If mindfulness or meditation is what's going to, so just having a lot of different tools in the toolbox is good for both the provider and the patient.
Yeah,
absolutely.
So to me, they complement each other.
All right. I agree. I have one last question, and then we're gonna wrap it up with some other questions. Yeah, the Veterans Crisis Hotline, 1-800-273-8255. Please write this down. If you're watching, you're not a veteran, and you know of a veteran that might need assistance, please give them that number or connect them with the VA. The last question, Dr. Greenberg, and it's in regards
second to last.
Yeah, second to last. So at least last question for me.
Right.
PTSD, from my understanding, and you can please correct me if I'm wrong. From my understanding, PTSD is an umbrella of symptoms, right? Because it isn't itself I mean, you can diagnose somebody with PTSD, but it is entailed with other symptoms that can occur within PTSD.
Or a lot of symptoms.
That is right. That's correct. So at least in terms of the way that these conditions are classified, it's considered a syndrome. So that means it's a collection of different symptoms that a person experiences. So there's a list of them, and if you meet so many criteria, then you quote unquote qualify for the diagnosis. Now that's on paper, okay, but we all know that out in nature it doesn't always look the same, right? And the point is that the underlying point of it is that a person's had a really traumatic experience that has a profound impact on their mental state and their quality of life. There's a lot of typical features, and those are the different symptoms that we're talking about. But the features can be different for different people.
So for those that are watching, it doesn't necessarily mean that you have to meet every single criteria. It's just that it has to impact your life significantly that you can get a diagnosis.
Right. Normally, you have technically speaking, for the diagnostic criteria, you have to meet a certain number of them, but you don't have to meet them all.
Yeah.
Okay.
And I think that takes away from the stigma of people saying, well, you have PTSD, and they automatically consider you to be on a very high extreme of
absolutely, right? It's a spectrum. A spectrum. Yeah.
Yeah. All right.
Yeah. So we have someone that says psychologists wanted to diagnose with PTSD, and I showed some symptoms, but didn't follow through with it. Didn't feel right because I'm assuming that says to actual combat vets. So he's not a combat vet, from what I understand. So
well, Eric, and I got to bring this up because I think a lot of veterans push themselves down, but the things that we are exposed to, even outside of combat, can be traumatizing to an individual.
MREs. Yeah.
So that does bring up another question, and I know that I said it was my last question, but survivor's guilt.
Yeah.
So when you're
It's a
talking
big issue.
about yeah, it's
Big
a
issue.
really big issue when you're talking about PTSD and these veterans that are coming back that might not have experienced direct combat, but they did experience loss.
Hmm.
Loss of members, loss of So these survivors. So how would you approach a survivor's guilt, like Eric just mentioned? Because that's
Well,
exactly what Eric was talking about.
yeah, Jose, you just brought up a super important point that I'm glad you brought up, because I've been hoping it was going to come up in this conversation. I want to make sure that I brought it up. The way we were just talking about PTSD 2 minutes ago is a little bit old school, and the field is kind of starting to move a little bit beyond that, what I think is a little deeper level.
Hmm.
Okay, so there's something called moral injury. I don't know if you all have heard of this term.
Yeah.
So moral injury is the idea that one goes through experiences in life, or it could be one experience, it could be many, that violate one's own moral code, one's own sense of values. There's an injury to one's own morals, but I don't mean just morals in the sense of here's the certain rights and wrongs. It could be rights and wrongs, but it could be something else. So often just a very basic example, often these are things that a soldier or a Marine or an airman or a seaman is asked to do, is commanded to do by commanders that goes against their code, right? So that's one type of moral injury, and survivor guilt is kind of related to that. It's these ideas. So the idea is that PTSD is not just these list of symptoms like nightmares and flashbacks and hypervigilance, but it's something about an identity crisis of sorts. At least it can be. That my identity has been changed because I violated this thing, or I was commanded to violate this code that I have with myself. It's not okay to do X, Y, or Z, and yet I did that. Or again, how come I should be the one to survive when this person didn't deserve to die?
Wow.
Eric, please pay attention, dude. Please.
Yeah. And so that's an evolving field, and we're just trying to learn how. You asked me, how do you treat that? How do you address that?
Yeah.
That is so cutting edge that I myself am not that well informed about it. But we have there are psychologists who study this and are developing. A lot of it has to do with group work. Group work getting to be where because people feel alone in this, right? They say they feel very ashamed, they feel very guilty. So getting it out in the open and saying, look, this is a shared experience. We need to talk about this.
Yeah, absolutely.
And
definitely.
you know what? Something that and a lot of people forget about is that doctors never stop learning. They think they're the system matter experts and know everything. And I'm going to tell you right now, we don't. We are constantly looking for
lifelong learners.
And we're always looking for those individuals to bring up the problems that are going on. If somebody never came up and said, hey, you know what, I feel so guilty that I survived, I'd never been to combat, this topic wouldn't be happening right now. Right? The research wouldn't be happening right now. The VA wouldn't be looking at these individuals at all. So
that's right.
You have to speak up on these matters so that it becomes something known and doctors can
be honest with
study on that. Yeah.
Be honest with yourself.
Even this in back in the old days, shell shock, which was the precursor to PTSD, was shunned. Like, don't worry about it. It was just it was just combat stress. You'll get over it. You'll get better. Time will cure it. Don't worry about it.
Yeah.
But now it's a serious issue but it was because it was brought on multiple times and it's just a reoccurring thing. But if you like the same thing with PTSD and other things, mental health issues, then you have to continuously bring it up so that it put it up in the forefront so that it becomes an issue and people are starting to look at it. So
start doing studies.
Yeah,
absolutely. Well, for those that have been chiming in, thank you so much for sharing your experience, and Dr. Greenberg, thank you so much for joining us. It's been very informative. This is awesome.
Yeah,
I'd love to have you back again. Because I know there's a lot more to talk about mental health. So and for you guys, we appreciate the love, for you guys subscribing to our channel and everything. So really we appreciate it. So remember, like this video, share this video.
Wait.
Oh, okay,
Wait. You have a question you need to ask.
Oh yeah, I keep forgetting. Thank you. That's right.
Jesus.
All right.
I'm sure he has one, but
yeah, no, I have to. Now it's a thing. Now it's like a thing. Now you always.
It is a thing.
Yeah. So now you gotta say it. You always have to remind me now. So
All right, go.
All right, go ahead. But anyways, Dr. Greenberg. So, have you ever tried MREs?
I'm sorry. Have I done what?
No, not done.
have you tried?
We're not doing it. We're not doing it.
What are we doing? Have you tried MREs? You know, military.
Oh, have I tried MREs?
I've
never. I know what MREs are, but I have not tried them.
All right. So, Jose.
Guess what you're eating in the office next time you're in.
You gonna bring me some?
Yeah.
I have plenty, sir. I have plenty.
We need to get you a meal ready to eat. They look like they're bags. Let me grab you one. Hold on.
Yeah, go get one because mine's under my bed. So.
Yeah.
Yeah.
Oh, chicken pasta.
Hey, if you guys are watching this, what do you guys
pretty
recommend so we can actually offer him?
Yeah.
I say beef stew, but this is me, number 9.
No, I think in my gun bag I have.
Wait.
If you have tacos,
my rifle bag that's under my bed. I have macaroni and cheese or no?
That's what I have. Mac and cheese.
Yeah, mac and cheese. I think I have
chicken pasta.
Well, mac and cheese I haven't tried. Well, unless he's lactose intolerant. So, but
I don't even know if that's real cheese, but
I don't think so either.
I think it's artificial cheese.
Yeah,
I'll let you try one, Dr. Greenberg, if you want to.
I would love to.
All right.
All right, guys. Thank you so much. And again, show the love. Subscribe to the channel. 10hutshow.org. All right, guys. Till next time. Salud.
Drink responsibly.
Yes.
Thank you for having me. This has been really great.
All right.
Thank you.
Stay on the line, sir.
Oh yeah, stay hydrated, everyone, for the weekend. All right, don't do nothing stupid over July 4th.
Yeah.
All right, peace.
Be safe.